A major announcement from Apple and Google today. They are teaming up to create voluntary coronavirus tracing and tracking software for iPhones and Androids to tell people if they've been near an infected person. You essentially get an alert. It's a type of contact tracing, which experts say is key to stopping the spread. The companies say privacy safeguards will be built in. The ACLU said today it should only be used for public health purposes during the pandemic.
Andrew, when you look at the other issue, which might expedite some of the relaxing of the rules, it's a technology issue, isn't it? The idea of an app, a tracking app, which the government's looking at modelling its approach to that which was used and is being used in Singapore.
It does sort of feel like a lot of things are going to happen in the next 2 to 4 weeks. So in the next 2 weeks, we get this app. You download the app. Say you and me download it, Kieran. We cross paths. We meet for 15 minutes. I get COVID-19. I go... You're annoyed with me because I've probably given it to you, but I mean, I go along to the doctors. They say, let's download your data, see who you've met. They then ring you and say, Kieran, look, you better have a test for COVID-19 because you've been in contact with Andrew for 15 minutes. And that really sounds like a preferable method if you're able to forgive the temporary loss of privacy. They call it a temporary loss of privacy. They'd say health would hold it. For them to track down people quickly and stop the spread, and that's what we've been about the whole time. So makes a lot of sense. But I really think the debate in the next couple of months, and I mean, it remains to be seen if some of these social restrictions being lifted changes this, will be about can we actually eradicate this thing. Now, Brendan Murphy, the CMO, he spoke last week about, he was asked if it could be eradicated in Australia, and it could if borders were shut, he said, but it probably would mean social restrictions for longer. Let's just have a listen to what he said about that.
The issue, though, is that then you don't have any immunity in the population and you really have to control your borders in a very aggressive way, and that might be for a long time. So that is one option.
As soon as he said that, Scott Morrison kind of jumped on him because I think the PM sees that as not as achievable as perhaps the CMO does. So they're sort of in between this sort of containment and just flatten the curve policy. But the more this curve flattens, and you show it every day, Kieran, the more I think eradication is a possibility. And then we'd just become a domestic economy till they got a vaccine. The indications and hopes are that you would get a vaccine. Let's have a look at that. Scott Morrison had some interesting comments on 6PR earlier about how people might accept this sort of invasion of privacy where they wouldn't normally. It's like in wartime he's saying you accept more deprivations of liberty than otherwise, and we certainly have so far. Let's have a listen.
Well, it's a bit like buying war bonds during the war. I mean, there are things that we might not ordinarily do, but in these circumstances, to keep people safe, to save lives, and to save people's livelihoods and get them back to work, if that tool is going to help people do that, then this may be one of the sacrifices we need to make.
Everywhere we go, every person we encounter, there's a good chance that smartphone is tracking us. The device stores data on places we've visited, information that could prove useful in flattening the curve.
That is an area of great interest to every jurisdiction. There are many, many innovators with lots of different ideas.
Take this app that logs a user's recent locations, warning them if they've crossed paths with a known virus carrier.
The more people that are in this, the better it's going to work. This is not some sort of tracking service, and there is literally no way for the government to live track anyone.
The technology has helped in Singapore and other Asian countries. Now Apple and Google are teaming up to allow for automatic contact tracing using smartphones elsewhere. And Britain is testing its own app for those who fall ill.
The app will then send an alert anonymously to other app users that you've been in significant contact with.
On my phone, in the app.
Canadian developers wonder when the technology will be approved for widespread use here.
There's going to have to be some clear guidance, especially to inform the makers of technology of how we can use these.
Canada is already reaching out to those potentially exposed, but it's the old-fashioned way, on the phone. The government hasn't ruled out using mobile device data, and that's quickly led to privacy concerns.
We have to subject it to great scrutiny. We have to ensure it's time limited with a clear deadline.
The technology's not perfect, but facing a global pandemic, every step could make a difference.
And finally, what I want to talk about next is the additional thing that's going to allow us to do, and that is to allow us to stand up a very robust, very aggressive contact exposure tracing system in the state of Ohio. And so I want to talk for a moment about this. And I've asked our Department of Health Medical Director, Dr. Mark Hurst, to join us on Skype today to help explain to the people of Ohio exactly how this tracing system works, how we can trace the virus, and why it is so important in helping us go after and attack the virus. Frankly, what I like about this and why I'm so excited is it's going to enable us to really go on the offensive as we attack the virus. The virus will stay, but when we separate people and when we're able to make sure that someone who has it does not spread it to others, that is a wonderful, wonderful thing. Before we talk to Dr. Hurst, I want to again thank all Ohioans. Thank you for what you have done. You've been absolutely amazing. You have achieved a great deal, and it's because of what you have done and not done the last few weeks. You have gotten us to where we are today. You've done this the way, the Ohio way. We've done it together. Ohioans are fighters. We now have the ability to really go on the offensive against this enemy. That means we're going to track it down. We're going to isolate it, and we're going to go after it. And the way we kill it is making sure it does not spread to another person. So when that person is in a situation where they're not spreading it, that's a great, great victory. We're going to isolate it, kill it, because if it doesn't have anyone to come into contact with, it simply cannot spread. This is an aggressive strategy, but I think it fits Ohio, and I think it fits our attitude of how we deal with problems. Contact exposure tracing is one of the strongest weapons we can employ to help our families, our friends, and ourselves stay healthy. This is going to all be done in a voluntary way, where we can take some control over this disease. By stopping the spread, we are protecting others, we are protecting ourselves. Contact tracing is one tool. It works along with our other efforts, does not replace anything, but it's another thing, another tool in our toolkit to go along with the social distancing, to go along with washing our hands, to go along with, in public, wearing a mask. These are all things that are very important. And today we have an additional tool. I'm going to also mention that we are partnering with Partners in Health, and I mentioned them several days ago. A group based in Massachusetts, started by someone I've known for a long time, and that's Paul Farmer. Friend, I've known Dr. Farmer for many years from his work in Haiti on the AIDS problem and on other medical problems. Partners in Health is a world-renowned organization that works to protect communities, and we will bring them in to Ohio to help us on the tracing program. What does she do at that point after knowing that Bill is positive?
So when she found out that Bill had a positive result, she'd reach out to Bill, make sure that he was isolating, and then she'd have a conversation with him about who he may have been in contact not only while he was ill, but for the 48 hours before he was ill. Because we know that people shed the virus for about 48 hours or so, up to 48 hours before they first become ill. So all of those individuals that he may have come in contact with that time could be at risk for contracting COVID-19. She'll really do a pretty extensive interview with him. It could take half an hour, 45 minutes, and really go back with him to try to jog his memory about where he was, who he'd had contact with, how close those contacts had been, and then determine whether any of those individuals needed to be contacted themselves and informed that they would be at risk for COVID-19.
Okay, that is done by phone?
That's a phone interview, yes.
Phone interview. Let's assume we've got assume we've got 3 people up here. Let's do Mike. We'll do Peter. Let's do Anna. Okay. And what is the standard when this interview is going on with the community health worker with Bill? What's the criteria? And I think you mentioned this, but I want to go back to it. What's the criteria? Let's say Bill, for example, he went to the grocery store during that period of time, or he may have gone and gotten gasoline or something, and maybe he also walked over and talked to his neighbor. So how do you determine what's the standard by which these people you're going to try to contact these? How did somebody get into this box, Mike, Peter, and Anna? What's the standard of contact?
Yeah, so it really varies a lot, and it's based upon both how close the person was to other people and how long that exposure had been. So let's say Bill did go to the grocery store and wanted to pick up milk. The community health worker would say, well, tell us about that experience. Tell us what happened with that. And Bill might say, I went in, it was about 6:30 in the morning, there was hardly anybody in the store. I picked up my milk. I may have passed by somebody really quickly during that time, but I was wearing a mask. I did self-checkout, so I didn't see a cashier or anything. That would not be an appreciable contact, and that person wouldn't need to be pursued in any way. If he talked to his neighbor and they kept 10 feet apart or so, that really would not be an appreciable contact. If his neighbor came over and they had dinner together and neither of them were wearing a mask and they were within a few feet of each other for an hour or so, that would be an appreciable contact. So that person would then be informed that they had likely been exposed to COVID-19 and that they need to quarantine for 14 days.
And so what would be is appreciable contact? Is that the term, or what would be the term that you're looking for here?
Yeah, the technical term is close contact.
Okay. Okay, so the health worker has now determined that Bill had contact with Mike, Peter, and Anna, and what happens next?
So then there would be outreach to each of those individuals, and they would be told that, you've had contact with somebody who has confirmed COVID-19, and you really need to quarantine for the next 2 weeks. You shouldn't go out of the house, and during that period of time, you need to check for symptoms and check your temperature twice a day. There's some monitoring that occurs with that. And generally, that's done electronically at this point, that people can just send a text message to a site and say, checked myself today, no temperature, no symptoms, things seem to be going okay. However, if during that 14 days they start to experience symptoms, then they need to go the same route Bill did. They need to contact their healthcare provider, tell them that they're experiencing symptoms, and then follow the advice of their healthcare provider regarding isolation and testing.
And my understanding is that we think our goal is about 1,750 people who will be involved in doing this. That's the last figure I saw. I know it's roughly. That's the last figure I heard too. I mean, when you consider that so far we've had
15,000, somewhat over 15,000 confirmed cases at this point, we can see that's a lot of volume, and to do this kind of follow-up with that number of people really requires a substantial workforce.
But it's the only way. If we want to stop coronavirus, we gotta be a team in this effort, and we need your help. Don't consider this a mandate. Consider it a service for you and your loved ones and the people you care about, and all of us as a society, a tool to help really hunt it down, to isolate it, and to kill it. That's what we're talking about. That's the offense. That's what we want to do with the coronavirus, because once you do that, it can't spread. If it's alive and it's in us, we're the ones that spread it. You isolate it and you kill it, and it's done. It can't harm anyone else. And you combine this with the social distancing, the masks and the disinfectant. You put these all together, and Ohio has a winning strategy. We have a winning strategy to play offense and defense and to beat the coronavirus. And because we're not going to be able to just wait this out. It's not going to go away. It's going to be there in our world for a long time, throughout 2020. And we need to learn to live our lives with it, in it. We need to be wary of it, but we can't live in fear of it.